Okay, so there was a question that arose based upon the pre-lecture material, and that was with this figure here. So the question, well, so orienting to the figure, so you have mean force on the y-axis and you have time across the x. The red representing the forces of spinal manipulations performed on normal individuals, or you can think of it as live individuals in this case. And then the cadavers as shown in black. And the point of the figure is to demonstrate not the internal forces that are applied to the vertebral artery during spinal manipulative therapy, but rather that the manipulations that were performed on the cadavers that measure the internal strains are comparable to those applied to live patients. The article in question that this comes from is shown here. So this is from Walter Herzog, PhD at the University of Calgary, who speaks about the biomechanics of spinal manipulative therapy, not only within this study, but also in prior and future studies dating back to 2002 and up to current history. And they mention figure 10. They show it here, but it's really mentioned in their discussion section. So during the discussion, they talk about previous studies that have been done by Simons and company and Herzog and Simons in 2002, where they looked at the vertebral artery during neck manipulative procedures. 6% of the cephalad and distal segments were much smaller than the stretches produced during ranges of motion and diagnostic testing. Thus, it would be suggestive that these techniques would otherwise be safe because of the relative low strain and stress that they put on the vertebral arteries. And then they mentioned down here that a limitation of these studies, of these historical studies, was the fact that the forces during the spinal manipulations were not measured and the significance that the external forces were not otherwise measured was that you can make the argument that perhaps these manipulative techniques performed on the cadavers were not comparable to that of spinal manipulation performed on live individuals. And so in order to overcome this limitation, they performed a pilot study to measure the strains on the external strains in the vertebral artery by having they performed a pilot study performed by 2 chiropractors on live patients as well as cadavers. And they measured the external forces to determine whether the external forces occurring on the neck and the biomechanics there within of the techniques were comparable. And that's where they reference figure 10. So the only purpose about figure 10 is to demonstrate that the manipulations performed on the cadavers and on live individuals are the same. Thus, we can surmise that the strains of that were measured in vivo on the arteries would presumably be comparable in a live individual. But they did not. What this is not showing is the internal strains or force time curves of the arteries, because right now the technology presumably does not otherwise exist to allow for that to safely be done in live individuals, but only in the cadavers.